Today we will discuss how to determine when you are in labor. After watching this video, you will better understand the difference between early labor and active labor, how to time contractions, what you can do from home during early labor, and when to contact your healthcare provider if you think you are in labor. First, let's discuss the difference between early labor and active labor. Labor is the work your body does to bring your baby into the world. In labor, the uterus contracts and tightens to push your baby down toward the cervix. Contractions may first feel like cramps you feel during your period, and then intensify to feel like muscles pulling painfully in your belly, and may sometimes be felt in the lower back. In early labor, contractions occur in irregular patterns. They may be spaced 15 to 20 minutes apart. They may stop when you lay down, take a bath, or hydrate, and they usually last less than 60 seconds. And the length and strength of each contraction, as well as the length of time between contractions, will vary. Over time, contractions start to change. In true active labor, your contractions will occur in regular intervals, becoming stronger, longer, and closer together. These contractions often last longer than 60 seconds and come and go in predictable patterns. Now let's talk about how to time your contractions. Once your contractions start occurring at regular intervals, it is important to time them. Timing contractions is done by counting the number of minutes from the start of one contraction to the start of the next contraction. Next, let's discuss what to do from home during early labor. There are some things you can do to help pass the time and take care of yourself from home. If it is nighttime and you're able to sleep, try to get some rest. Having a baby is hard work, and sleeping in early labor is a great way to save your energy for the hard work to come. If it is daytime or you are unable to sleep, feel free to get moving and go for a walk, or take a shower or bath to help you relax. You can ask your doula or partner for a massage to reduce muscle aches and pains, and always fuel your body for labor through eating and hydrating. It's important to remember not to panic when you start to feel contractions at home. Your body was made to bring your baby into the world, and you are strong and ready to meet your baby. Finally, let's discuss when to contact your healthcare provider if you think you're in labor. Using the 511 guideline will help make this determination. Call your healthcare provider when your contractions come every 5 minutes and last for 1 minute consistently over the span of 1 hour. Even if you're not within the 511 guideline, it is important to call if your contractions are so painful that you cannot walk or talk during one. Also, call your healthcare provider if your water breaks or is leaking. When it breaks, you may experience a gush of water, or you may feel a slow leaking or trickle of fluid on your leg. Both of these are normal. If your water breaks and you're calling your healthcare provider, try to remember the acronym COAT, which stands for color, odor, amount, and time. Does your water have a color, or is it clear? Does it have an odor? How much is there? What time did you notice a gush or leaking? Your healthcare provider will ask you these questions, so it's important to take note. There are some common questions people often ask when they're in labor. Many often wonder, are there other reasons to call the healthcare provider? The answer is yes. If you think you're in labor and you're earlier than 37 weeks pregnant, please call your healthcare provider. Also call if you have sudden severe pain that does not go away with rest, or you have not felt your baby move for several hours. Please call your healthcare provider. Another common question is whether bleeding is normal in labor. Some light bleeding may be normal as your cervix starts to stretch and open to make way for your baby. However, this bleeding should be less than you might experience with a typical period and should not soak your underwear or run down your leg. If you have this type of heavier bleeding, it is important to call your healthcare provider. Now that you have watched this video, you should have more tools to answer the question, am I in labor? This includes understanding the difference between early labor and active labor, how to time contractions, what you can do from home during early labor, and when to contact your healthcare provider if you think you are in labor. Thank you so much for watching this video and taking the time to learn about what to expect as your labor begins. Congratulations!